Good morning, Rosemary. Thank you for coming.
Morning, Jack.
We're with Rosemary Agostini at the ACSM meetings in New Orleans, and we're talking with some of our distinguished leaders in sports medicine and exercise science, and Rosemary is certainly one of those.
Thank you.
So welcome. I just wanted to start with if you could tell us a little bit about your present position now in sports medicine and where you're located and what you're doing and that type of thing.
Presently, I'm located at the Virginia Mason Sports Medicine Center. That's part of a bigger group called Virginia Mason Medical Center. And I'm a primary care sports medicine physician there. As one of the early sports medicine trained folks, most of my practice is musculoskeletal medicine. But it's quite an interesting combination. I've always been interested in working with high school and high school sports and the application of sports medicine to high schools. So right now I'm medical director of a program that oversees putting athletic trainers at all 10 Seattle public high schools.
Great.
So we're overseeing 10 schools, about 5,000 student athletes in terms of participation at the schools, all sports all year. And my small goal is to bring the best sports medicine and sports sciences to the Seattle public high schools, and then also to eventually have one athletic trainer per high school, having the athletic trainer also teach sports medicine at the high school level in Seattle.
How do you screen your trainers, and where do they come from, and what is their training? Do you get involved in that at all with the athletic trainers?
Trainers, right. There's a certification for an athletic trainer.
Is that NATA?
Right.
Okay.
It's been quite a challenge because there are no programs in Seattle, Washington.
For them to take their courses?
Yeah. So it's been a huge problem getting trainers. Plus the job is really difficult because there's a shortage of money. Mm-hmm. So one trainer has to cover 2 schools. And so that's a huge problem for us. But we're working on it. So I put a lot of time and energy into that. And then I see patients all day with shoulder injuries, back injuries, not many back injuries, elbow, knee injuries. And then sometimes, because of my past interest in high altitude and mountaineering medicine, if people are going on expeditions or trips, I'll help them out with some of the medical issues, if medicines they need for their trip. And then in my past, and still sometimes now, do a lot of work related to issues related to women in medicine, in sports medicine.
Mm-hmm. So you're seeing all ages?
I'm seeing ages from age 14 to 80 plus,
Okay.
yes, as long as they're active.
Yeah.
Yeah.
Okay. So you're practicing every day, basically?
I'm seeing patients every day.
All day, every day.
Right.
Okay. And how long has the Seattle program been going with the trainers and so forth? Is that pretty recent?
That's just the last 4 years. So before, there was a time in Seattle where Steve Rice had a program, and he was teaching the coaches how to provide care and do some sports medicine. And then there was nothing for a number of years. And then the school contracted with a group called Health South for a period of 4 years. And then Virginia Mason applied for the contract with Seattle Public Schools to provide this care. And so I've been working on that intensely for the last 4 years. Yeah.
I just wondered a little bit of your early career in medical school and how you sort of got steered towards sports medicine.
Right.
How that took place.
Right. Okay. So everybody has an interesting route, but
Right.
My parents are from the Italian-Austrian Alps. My dad came over when he was 19 years old. My grandfather was a coal miner in Pennsylvania.
That's where I'm from.
Yeah, there you go. So my grandfather, though, sent my grandmother back, and then World War II broke out. So my father was not able to come back to the United States until he was 19 years old. And always was skiing. So as children, even though it was unusual for girls to be participating in sports, we were doing our construction work and skiing and doing all sorts of other activities. And so always involved in sports. And my mother became a nurse. And so we had the interactions. But a little quick thing that's interesting, there was a time I wrote read a book called Women Treating Women. And in that book, it was two women psychiatrists talking about why women go into the helping fields and in medicine. And they had some little issue about that when girls and kids are around 5 years old, sometimes they'll have some sort of an event and that will steer them in the direction of medicine. And I was reading this and I said to my mom, have you ever heard of anything like this? And she said, well, that's very interesting because your paternal grandmother was dying of ovarian cancer and we took you to see her as a little girl, and you told her to hang on a little bit because you would grow up and be a doctor and you would take care of her.
Isn't that amazing? And your mother was a nurse when you were talking to
Right.
her about this.
Right.
Wow.
So, because as a 5-year-old, I was always taking care of everybody else. I was always practicing. I was going to grow up to be a doctor, but the people that are my parents' friends and colleagues are all people from Northern Europe. So no one had become a physician, so that was impossible. Mm-hmm. And then a girl didn't become a physician.
Right.
And so I spent a lot of time fighting with people, which is sort of part of what's been in my career.
So they were trying to steer you away, probably, saying, no, you can't do this. And
right.
you were saying, yes, I can.
Right, yes. And even as a child, I had an uncle who said girls weren't worth anything because they grow up and they change their name, and apparently I hauled off and kicked them. So I got some skills very early in terms of
soccer skills,
dealing with different organizations along the way about why can you do things and can't you do things.
So were you born in Pennsylvania then?
I was born in New York City.
Oh, okay.
Right.
Okay.
And then continued being in sports in high school, and in high school was the first president of the Girls Athletic Association at our high school. And when we were demonstrating...
When would that have been, roughly?
71 to 75.
Okay.
And then with people from my high school sort of marched at City Hall for the...
So this is just before Title IX.
Right.
I mean, basically...
Right.
A little before and right at Title IX.
Yeah, so that's why I was demonstrating at City Hall for the right for girls to participate in sports. And so that was just, part of my growing up. Mm-hmm. And then in New York City, they created a program called the Sophie Davis School for Biomedical Education. And it was to train physicians for inner city communities and people who didn't have access to medical care. So it was a 6-year program. It was based on the European model, so that you integrated the first 2 years of medical school as part of your college curriculum. And I was in the third entering class, and that was at CCNY in Harlem. And
so you started your undergrad there, and then it just flowed into medical school?
No, they were intercombined.
I see.
So as a freshman in high school, we had human anatomy in our cadaver, and biochemistry, embryology, trampoline, English 101.
What a great curriculum.
So we really combined actually it was the first 2 years of medical school, and we were given our college credit for that. And then during the summers, we worked in a program called, Community Health and something like, I can't remember exactly the title. Mm-hmm. And so as freshmen in college, we were placed in medical centers in New York City, but it was like going out with visiting nurses to visit people in Harlem, or a Chinese medical center in Chinatown. And so, and our teachers then were people who were like the head of medicine under Allende and Roberto Belmar, and the head of the person who helped end sterilization abuse in Puerto Rico. So people who, Jack Geiger, who was part of Physicians with Social Responsibility. And so those are the people that were my teachers as a college student.
Great start. Huh? That's fantastic. What interesting. So when did sports medicine jump into this?
So all the way along, I've been doing sports medicine. Our sports, no, actually, it's interesting because I have to give a talk, and I want to talk about what was like the turning point into sports medicine, but we always participated in sports. Mm-hmm. And so I was, as a medical student, we were at Harlem, but Lincoln Hospital, and that was a place where we were averaging 90 gunshot wounds and stab wounds a month. And so every third day you take a blood bath. I mean, it was just horrible in those days. But you have those little defining moments, and I was doing a knee exam on a young African-American man, and actually, I think I hurt his knee a little bit because he sat up and he punched his own hand. But we were talking about, once we started talking about sports and how he would talk to me. Mm-hmm. And so it really became clear that people of all races, all colors, that the language of sports was a way to communicate.
Yeah. They can all identify with sports or
right.
heroes or stars, or at least, yeah, I see.
Right, and so it became really clear to me that using sports was a way to communicate to a lot of different people who wouldn't communicate with you. Mm-hmm. And it became clear as I did my family practice residency, it was also a way to bring some basic health care to a community that wasn't interested in it through the language of sport. Mm-hmm. And that's been true, and the application of family medicine to sports medicine has been treating the team as a family. And what happens is that the coaches are the parents, the athletes are the kids, and then the other people are the supporting family. And so...
What a great concept. Yeah.
Right. And it's very interesting because sometimes the orthopedic model, which I did some of my training on, when you ask this one orthopedic surgeon, and he said, what's the best thing about sports medicine? He said, it's running out on the field and having all the lights on me, you know. And I was like, oh gosh. And so that's why the family practice concept is so huge, and especially in the inner city, these kids, their parents are working, they don't have parents, mm-hmm. and so you have a structure, you have sidelines, and recently there was a study done called The Silent Epidemic by the Gates Foundation, and the silent epidemic is about kids dropping out.
Yeah, because the literature I've seen, Rosemary, says that sports and their friends are what keeps them in school.
Right.
So it would fit perfectly
right.
with that, I think. Right.
And then, you know, having the family, so I did the important, I guess, thing that I need to get also on this is that then I did my family practice residency in Rochester, New York, and as part of that, we would go to Lake Placid. There was a meeting, and there was a sports medicine meeting there, and John Lombardo and John Bergfeld were putting on that meeting. And at that meeting, they were talking about that they were going to start a sports medicine fellowship, and it was going to be the first in the country. So at that time, I was finishing my residency, and I was taking 2 years off to travel. And Lombardo's had 4 other applications. And I said, well, I'm interested in sports medicine.
Was this at Cleveland?
No, we were in Lake Placid when I met him.
Okay.
So he said, hand me an application right now. Here, write your name down on a piece of paper. And the next part was to, I was on my way to Aspen and then going to base camp on Everest on a trek. And I told Lombardo and Bergfeld, I can't come to Cleveland Clinic. I'm leaving in a week. And they said, you have to. So I left Aspen, working as an ER doctor, went to New York City, packed and unpacked my stuff, did a day trip to Cleveland, did my little interviews, and then said, bye, have a nice day, and got on a plane that Saturday to do a trek to base camp on Everest. So when I came out from the trek, and I was in my hotel in Kathmandu, I called my parents, and they said, there's a letter here for you. You've been accepted into the Cleveland Clinic Sports Medicine Fellowship. And the next meeting with John Lombardo was here at the American College of Sports Medicine. And he sat down and took a napkin and wrote out what my fellowship was going to be, who I was going to rotate with.
What year was that, Rosemary?
So that was 1985.
Okay.
So the first year of the fellowship, the first official fellowship in the United States was at Cleveland Clinic in 1985-86, and I was their first quote-unquote fellow. Mm-hmm. And there we worked with high school, college, pro sports, et cetera.
Mm-hmm. And is that when you joined ACSM then, in 85? Or had you, when?
Right, 1985,
yeah.
because
yeah.
before that, during our family practice residency, we didn't have anyone doing sports medicine who would have known about the American College of Sports Medicine.
And what have you, I know you've been involved since then very actively in ACSM, and I was just wondering if you could highlight some of the different things you've done in the college. I know you've been involved in the triad.
Right. During my sports medicine fellowship, they talked about that they needed somebody to look at girls, and there was a chapter that needed to be written, so I got assigned the chapter even though I didn't have a clue about writing anything. And also we had to do a little research project. And somebody was suggesting that there might be a problem with girls and bones and stress fractures. And they said maybe it had something to do with estrogen. And I said, of course, that's stupid. You know, they're always blaming estrogen for every reason we have a problem in sports medicine. But what then happened was I did a little study looking at the biomechanics of stress fractures. And so that was a little bit of background, and I didn't, you know, weren't aware of the eating disorder problem.
Yeah. You hadn't come to Seattle yet.
No, no. So after my fellowship, there was a year that I was traveling again, and then I got the job at Virginia Mason Sports Medicine. That was in '87. And then I was having arguments with people at the American College of Sports Medicine about why there weren't any lectures on women in sports, why there weren't clinical lectures on women in sports, etc. So the next step was, I finally was arguing with someone enough that another friend said, Rosemary, come here, listen, you know enough people, you can put on your own meeting. So in 1991, I organized a conference called Medical and Orthopedic Issues of Active and Athletic Women. And at that meeting, Barbara Drinkwater talked about bone health, Mimi Johnson talked about eating disorders, and Lori Marshall talked about amenorrhea. Mm-hmm. And at that meeting, when Barbara Drinkwater realized that young girls who in the environment of sports could start having issues with eating, and if they developed anorexia could die, she thought that was absolutely not tolerable. Mm-hmm. And so within 1 year it got funding from NIH and ACSM and put on the first think tank meeting on the female athlete triad, and that's where the term was coined.
Okay. And where was that?
In Washington, D.C.
Yeah.
That was another series of fights with the ACSM. So Barbara Drinkwater was on the board at that time, and what happened was at the meeting, they wanted the meeting in Indianapolis, and we strategically planned it to be in Washington, D.C. so that we would be able to talk to the media, that we would be able to have a congresswoman, and apparently Barbara Drinkwater took off her shoe and started slamming the table at the board meeting that they should not interfere with these young women who were working on this project. And then Barbara said to me one day, she said, I've gotten into more fights since I've been working with you in my previous career. So since then, that's history then, right?
Yeah, the rest is history. Sort of the last thing, what do you see are some of the issues that ACSM needs to get into in the future? Right.
The last little piece of history that's important that I want to put in there is that eventually with some of the, so it is because of the ACSM that the female athlete triad got off the ground, mm-hmm. became a national issue, that people are doing research in it, that we're going to take care of young women, and there's a lot of emotional issues around that. The other important piece was the formation of the Strategic Health Initiative on Women in Sports. Oh. And so that again was saying that there are enough issues that need to be looked at, and then being on the board was a really interesting experience, and that was another series of learning how to work in a huge organization and a committee and et cetera. So it was another series of I guess the word keeps coming back to fights.
You're a troublemaker.
I was going to say,
when was that? When was that?
That was when Tim White was incoming president and president.
About what time then? I can look it up easily enough.
Right, because there was one meeting where there was supposed to be a board to pass this, whether or not we were going to have a strategic health initiative on women in sports and then on children, and there were some forces that didn't believe it should exist. And the decision was supposed to meet at board meeting, and it was really clear it was going in the wrong direction. And Tim White and Russ Pate called a bathroom timeout, got me out in the hallway, and they said, Rosemary, you have to trust us. Uh-huh. and we are going to table this issue. And by the next board meeting, the people who are so adamantly against it will be off the board, and we'll do the homework we need to do.
Wow.
And by the next board meeting, Tim and Russ had talked to everybody, explained to them why it was a good idea. I came into the next board meeting, and it passed.
No fight.
No fight.
Okay.
So ACSM provided some huge learning in terms of the political dance of how to get things done that are important and good things for athletes. At the end of the day, it's taking care of
Right, that's
people
the bottom line.
is the bottom line. But the dance is a complicated one.
Right.
So in terms of my relationship with ACSM, one, it has been my home as a primary care sports medicine person because there were no other organizations at that time. Now there are some other organizations. It's given us the opportunity, it was the venue to bring the female athlete triad, the interrelatedness of eating disorders, amenorrhea, and premature osteoporosis to the forefront. And it was important because it was the physiologists, the educators, and the physicians, scientists, and clinicians all are working on this project because it's so complicated. So that's a piece. Then the Strategic Health Initiative on Women in Sports has looked at ACL tears, exercise in pregnancy, benefits of exercise for women in sports. And so at the present moment, I'm not involved in those things as much right now in terms of the college, but it has been the avenue. And then of course the idea is the family practice, that you have all different kinds of people in the family, and so to be in an organization. And then the last historical part is this is where I met my husband.
That's right.
So
And it wasn't the result of a battle either, I bet.
well, that's actually the part. It actually is.
Uh-oh.
Because when I arrived here, that was the talk apparently was there's a new sports medicine fellowship, and that was a big deal that it had to do with the clinical stuff. And I arrived, and he thought it was very interesting that I was fighting with the old boys, and that was very attractive.
I see. Okay.
And for those people who know my husband, it makes sense.
Yes, all right.
So, yeah.
Okay.
So I guess we should document that it is Dr. George Brooks, our honor award winner. So we've been the team, the sports team. Good. Thank you.
Well, thanks so much, Rosemary, for
You're
taking a
welcome.
little time to stop and chat this morning.
Yeah.
And thanks for all of your battles.
Thank you.
They've been good.
They've been good ones, yes.
Worthwhile, yeah.
Thank you
Okay,
for this
thanks so
opportunity.
much.
Yeah, good. All right.